Just how prepared is the United States for a potential Ebola outbreak? It is a matter of debate this morning. John Blackstone is in San Francisco with the competing opinions from inside the nation's healthcare system. John, good morning.
Good morning. Well, the CDC is assuring the public that hospitals like this one in San Francisco stand ready to handle and contain any cases of Ebola. But in a survey, nurses from across the country say they fear their hospitals are not ready. Hospitals have been told how they should prepare for patients with Ebola, but nurses who come in contact with those patients still worry.
We saw in Dallas that, they, I think, believed that they were prepared, and clearly they were not.
Katie Romer, a nurse for 20 years in California, says the images of fully protected healthcare workers responding to Ebola show equipment that her hospital does not have.
We're seeing people in hazmat suits. We're seeing people with a higher level of protection, and that's what we would like. We would like to have those protections for our patients and ourselves.
We are the nurses!
In Las Vegas, nurses marched to show their fear that hospitals are not ready for Ebola. Of the more than 1,500 nurses who responded to an online survey by National Nurses United, nearly 80% say their hospital has not communicated to them any policy regarding potential admission of patients infected by Ebola. The director of the Centers for Disease Control, Tom Frieden, admits the arrival of Ebola in America is frightening, but suggests that could be a good thing.
For the healthcare workers who are caring for people with Ebola, we want them to be scared. We want them to have a healthy respect of the risk of any lapse.
The CDC has issued a detailed hospital checklist for Ebola detection, protection, and preparation. It says now is the time to prepare. Attendees at a California nurses convention on Monday expressed confidence the system is working.
We treat patients with HIV, we treat patients with hepatitis. As long as I do the necessary precautions, wearing gloves, wearing a gown, wearing a mask if need be, then I'm totally safe with treating a patient who has Ebola.
A new poll says most Americans have at least a fair amount of confidence in the government's ability to prevent an Ebola outbreak in the U.S. For healthcare workers, Ebola is just one more risk in an already risky job. Nora?
All right, really interesting, John. Thank you so much.